Hi everyone, my name is Crystal Lim and I'm a nurse practitioner student at Franklin University. I'm going to be giving a presentation on GERD, gastroesophageal reflux disease, and how to improve symptoms through lifestyle changes and diet modifications. I'm going to be referring to gastroesophageal reflux disease as GERD throughout the presentation. If you're not common with GERD, GERD is also known as reflux or heartburn, and it's one of the most common diseases of the digestive tract and is a common complaint seen in primary care clinics. And you might be asking, what is GERD exactly? Well, GERD is when the stomach acid goes up through the little sphincter at the bottom of your esophagus and stomach where they're attached, and it goes up into your esophagus, and it can go into your mouth even. This is backwash and it's called acid reflux. It can irritate the lining of your esophagus, stomach, and first portion of your small bowel. Most people have the irritation right here in the middle area. The irritation then can give you symptoms. They can be mild, maybe no symptoms, or severe. It can be a burning sensation in your chest, and that's what most people have, and they refer to that as heartburn. Sometimes it's worse after eating, maybe after eating a large meal, and even worse at night. It can be worse at night, especially if you lay down right after you're done eating, and you might even have some wheezing at night. Other symptoms can be chest pain, belching, coughing, hoarseness, difficulty swallowing, regurgitation of food, waking up with a sour taste in your mouth in the morning, and sometimes even having a hard time swallowing or feeling like you have a lump in your throat. Not everybody has reflux. Some people are more prone to getting it, and there are some risk factors that go into having reflux, GERD. If you are obese or a smoker, you're at a higher risk of developing GERD. There's an increased risk as the older you get. It's higher in males, and if you have a higher BMI, so being overweight, or if you're from a rural area. However, anybody can have GERD. Anyone from an infant, tiny little babies can have GERD, all the way up to elderly. It affects about 50 to 60% of pregnant women. That extra pressure from the tummy pushing up on the stomach can make you have reflux. There's also certain foods that can make it worse. Spicy, greasy, alcohol, caffeinated beverages, chocolate, citrus fruits, coffee, fatty foods that are fried or greasy, oils, onions, peppermint, spearmint, tomatoes, or tomato-based products. And again, not every food is going to affect everybody the same, so it could affect one person. Chocolate can affect one, but not the other. It all just depends. And a good way to track that is to keep a diary. And there are also some medications that can irritate the stomach lining and increase the risk of getting reflux, and a lot of those are aspirin or NSAIDs and non-steroidal anti-inflammatories that are going to irritate your stomach lining. The treatment of GERD. You can treat it with medication, but we first want to try lifestyle changes. And lifestyle changes can help you feel better and make better choices so that you aren't having the GERD. Some medications commonly used are Tums, Nexium, Prevacid, Prilosec. Those are over the counter, and then there's some prescription ones that you can take as well. But I want to focus on some lifestyle changes that can help reduce the symptoms with GERD. Lifestyle changes. So what can we do to help you feel better? Things that you can do. One of the main things is if you're a smoker, we need you to stop smoking. That can really help decrease the risk of having GERD or having worse GERD. Smoking also increases your risk for many other diseases. Smoking decreases the esophageal sphincter ability to function correctly. And that's that little area that connects your stomach to your esophagus that lets that acid come back up. Another thing that's been proven is weight loss to help prevent symptoms. Being overweight can promote reflux. Excess abdominal fat puts pressure on your stomach and can push up, again, just like I said about pregnant women, can make that feel like a pushing sensation where you're going to push that acid up into your esophagus. So just by losing 5 to 10 pounds may be enough to decrease your symptoms. Sometimes it might be a little bit more, but that's always one good way to try to prevent the symptoms is by weight loss. And to get to weight loss, exercise. Exercise is helpful. People who exercise tend to lose weight or have lower BMI, so try to get 30 minutes of exercise a day to help decrease those reflux symptoms and help decrease your BMI. Also, decreasing or eliminating alcohol is going to help. It's going to decrease those symptoms of GERD. Eating smaller, more frequent meals will help by not overfilling your stomach and not making it backflow up into your esophagus. Try eating slower and chewing your food. That'll help your stomach digest everything and make it easier to digest. Also, avoid trigger foods. Again, some can be triggers for some people and not the other, but you need to keep a diet and see what helps and what doesn't help you. So you might be avoiding foods that are spicy, fatty, greasy, fast foods, carbonated drinks, coffee, or any other trigger foods. One thing that I thought was interesting is that peppermint and spearmint actually, and caffeine, the way that they make your reflux worse is they decrease that tone of the muscle that holds your fluid and the acid inside your stomach. So it decreases that tone and then lets it come up. So by keeping that diary of food and the symptoms can help you work on eliminating the ones that make you feel worse. Avoid wearing tight-fitting clothing. Again, that's a pressure, a mechanical thing that's going to press that stomach acid up into your esophagus. Try not to eat 2 to 3 hours before going to bed, so no midnight snacking. This gives your stomach a chance to empty, and it's less likely of having that extra fluid backflow up into your esophagus and decrease the symptoms of GERD. You can also try and sleep with your head of the bed elevated just a little bit, whether it's putting a couple pillows behind your head or even getting some blocks and propping the bed up to help keep the backflow, mechanical flow of the acid in your stomach from going back up into your esophagus. And good sleep. Try to get some good sleep. It might be hard to do that if you're having reflux, but if you can do some of these things to help reduce the symptoms of acid, you might be able to get a better night's sleep. And sleeping helps. If you have a good night's sleep, it's less likely to have GERD symptoms. If the GERD remains untreated, it can cause permanent damage to your esophagus and change the esophagus tissue. You can have erosions or ulcers, and having those issues change the lining of your stomach. It can put you at higher risk for getting esophageal cancer. So as we discussed, there's a strong connection between eating habits and lifestyle changes that can increase the severity and frequency of GERD. So it's essential for you, if you can, to pick some of these things to try to help make your GERD better. And you can do it. Again, thank you so much for watching. I hope this helps reduce your symptoms of GERD by making some easy lifestyle changes and diet changes. Thanks. Y'all have a great day.